Hello and good afternoon. I am Dr. Hillary Cunnins, Director of Behavioral Health and Mental Health SF here at San Francisco Department of Health. Today, the San Francisco Office of the Chief Medical Examiner released the preliminary number of lives lost to accidental overdoses for November. 57 people tragically lost their lives to overdose in our city in last month. To date, from January 2023 through the end of November 2023, the total of 752 people experienced an accidental overdose in San Francisco. The majority of these preventable deaths continue to be driven by fentanyl, with more than 80% of the deaths attributable to that substance. San Francisco Department of Public Health continues to take vigorous action to save lives from overdose. We are engaging in a number of efforts, including expanding access to substance use treatment, particularly removing barriers to medications for addiction treatment, which are the most effective way to prevent death and overdose in people who have an opioid use disorder or opioid addiction. We are working to expand service hours, using novel techniques like delivering medications, conducting targeted outreach and engagement in settings where people may be at high risk of overdose, including shelters, permanent supportive housing, and people experiencing homelessness. We have been working to train thousands of people to effectively recognize and respond to overdose using the lock zone. We are also seeking ways to expand innovative interventions like contingency management, which is a particularly effective strategy for people with stimulant use disorder or stimulant addiction. Today, we are announcing that San Francisco Department of Public Health is embarking on another initiative to support our efforts. We will begin wastewater analysis testing for risky substances such as fentanyl, methamphetamine, and xylazine. During the COVID-19 pandemic, San Francisco Department of Public Health began testing wastewater under a state program to get a clearer picture of trends related to COVID-19 and other communicable diseases like influenza and respiratory syncytial virus or RSV. This month, under a federal program and in partnership with the San Francisco Public Utilities Commission, we will test wastewater for high-risk substances to get a clearer picture of what substances are being used in San Francisco. These data can help guide our overdose prevention efforts and create an ability to compare levels of specific substances in wastewater over time to add to our ability to understand and respond to overdose risk in our city. I want to thank the San Francisco Public Utilities Commission for their partnership and the federal government for support of this program. The fentanyl crisis is a national one and is affecting large cities like San Francisco and smaller communities across the country. We need the support and resources of the federal government, and this program is an example of ways in which the federal government can assist our efforts. Now, I'd like to welcome to the podium Dr. Jeffrey Hom, who will share more details about this program.
Great, thank you, Dr. Cunnins. I'm Dr. Jeffrey Hom, Director of Population Behavioral Health in the San Francisco Department of Public Health. San Francisco is grateful to be one of the 70 cities participating in this groundbreaking study funded by the National Institute on Drug Abuse, also known as NIDA. This wastewater surveillance program will measure and track the use of risky substances over time to help inform our public health interventions. NIDA has contracted directly with BioBot Analytics, a global leader in wastewater epidemiology based in Cambridge, Massachusetts, to do the testing and provide data to the city at no cost. San Francisco is specifically testing for fentanyl, methamphetamine, amphetamine, cocaine, and xylazine, as well as their metabolites, and naloxone and its metabolites. Wastewater analysis will give us a more complete picture of the trends in drug use, complement our other data, allowing us to act faster when emerging substances like xylazine are increasing in the local drug supply. Elevated levels of drugs and drug metabolites, for example, could be used to predict higher risk periods of overdose and prompt more strategic interventions by the city and our partners, such as targeted outreach and engagement of people who are at risk of overdose, increased naloxone distribution, tailored educational interventions for people using emerging substances, and public awareness campaigns. Under the wastewater surveillance program, our partners at the San Francisco Public Utilities Commission are collecting 150 milliliter samples of raw wastewater from each of 2 major wastewater treatment plants and are sending them directly to BioBot for analysis. The 2 treatment plants, one on the west side and one on the east side, together cover the entire city, excluding Treasure Island. The first samples were mailed in early December, and we're expecting our first set of results in January and then a regular cadence thereafter. We don't anticipate any privacy issues. These data are anonymous and give us a snapshot of risky substance use at a city level, not on a neighborhood or individual level. In an era when fentanyl is claiming lives at an unprecedented rate, we need all the information available to us to give us a more complete picture and guide our response. The devastation this drug has brought to thousands of communities, including ours, cannot be understated. Federal programs such as wastewater testing provide local governments just some of the tools needed to address the impact of illicit drugs. Thank you. We'll now take